In the year 2000, the United States declared that measles was eliminated from this country. What that meant was that there was no year-round disease transmission in the United States. Yet we continue to have cases of measles regularly appearing in our country. That happens because measles is still actively present in many other countries and is imported by travelers. Because of that, it's of critical importance to have high levels of immunization against the disease in order to prevent the spread of those imported cases and prevent reestablishment of the disease in the United States. Disturbingly, we are seeing a slow but steady rise in the number of children who are not getting vaccinated. This is a significant public health problem that puts our communities at risk. This issue was highlighted recently with a major outbreak of measles linked to Disneyland. Because of its importance, measles and what needs to be done to prevent its resurgence will be a focus of today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to discuss the disease of measles. Since most people have not experienced measles, we'll talk about the seriousness of the disease and why we need to have high levels of vaccination against it. We'll also talk about the reasons why we are seeing an increasing number of people not getting their children vaccinated and what's being done to reverse that trend. Joining me in that discussion is Dr. Ruth Lynfield. Dr. Lynfield is a pediatric infectious disease specialist and is Minnesota's state epidemiologist. Ruth, welcome to our program.
Thank you very much.
First of all, what is an epidemiologist?
An epidemiologist is someone who studies disease, especially disease in a population, and gets a sense of what the risk factors for the disease are and the interventions that we can use to control or prevent the disease.
All right, so we're going to be talking about measles. So why is epidemiology important in discussing measles?
It is important because measles, which interestingly the Latin root that it stems from means miserable, and measles is a miserable and it can be a very severe disease. And so it is important that we understand it, that we can recognize it, and that we can develop interventions that can prevent the illness and prevent the spread of the illness.
All right, so describe measles. What is it? How does it present? How is it transmitted?
So measles is a viral infection, and what happens is that it is transmitted from another person. Measles actually only circulates in people. So you need to be exposed to a person who's infected with it. And after a period of time, which we call the incubation period, which is generally 1 to 2 weeks, the person, typically it's a child, develops high fever, a runny nose, cough, and red eyes, and after a number of days develops a rash, which begins on the head and neck and spreads downward. And after a period of a week to 10 days, there is resolution of the illness. However, there are individuals who go on and develop complications, and that is what we're really worried about. And this can include pneumonia in about 5%. It can include diarrhea. It can include ear infections. It can include croup. It can include actually inflammation around the brain, also known as encephalitis. And there can also be additional infections caused by bacteria that can give one pneumonia.
Now, how is it easily spread, or is it difficult to spread?
Oh, it is very easy to spread. It is so easy to spread that people who have face-to-face contact, if someone is susceptible to measles, there is a 90% chance that there will be transmission of measles. And measles can be extremely severe in the setting of poor nutrition, and that's why in parts of the world where there are fewer resources, there's a much higher fatality rate, death rate. In the United States, it's estimated at 1 to 500 cases, but much higher, can be as high as 10 to 20% when it is in the setting of malnutrition, and there can be blindness as well.
Yeah. So given its spread before we had vaccines, this must have been a major killer throughout the world. Since it, a 90% chance of getting it, it must have millions and millions of cases.
Absolutely. In this country, before the widespread use of measles vaccine, there were about 4 million cases each year.
Wow.
And unfortunately, there were about 1,000 cases of encephalitis, the brain infection, which could lead to death, could lead to neurological impairment. And there were about 500 deaths each year in the United States. Mm-hmm. Most of the cases occurred in children under 15.
Right. And so when did the vaccine become available for measles?
The vaccine became available in 1963, the original vaccine, and there have been several different generations of vaccine. And today's vaccine is a wonderful vaccine. It is measles, mumps, and rubella in combination. It is a live vaccine so that it has a weakened virus, but it induces wonderful immunity. In children who receive it at 12 to 15 months of age, if they receive one shot, the vaccine is estimated to be about 95% effective. We did find that there were some children who didn't respond to the first round of vaccine. And in 1989, there was a recommendation that came out to give a second dose of vaccine. And that brought up the vaccine effectiveness to about 98, 99%.
Right. I want to talk a little bit more about the vaccine and some of the recent controversy about people not getting vaccinated, but first we need to take a little break. We'll be back right after this message.
Budget, so don't accept defeat.
Now you can get covered and still buy me treats.
You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
Welcome back. We're talking about measles with Dr. Ruth Lynfield, the state epidemiologist and a pediatric infectious disease specialist. Ruth, how effective, you mentioned a little bit the effectiveness of it. Are there people who should not get vaccinated?
Yes. People who have difficulty with their immune system. So that could either be, say, someone who has AIDS, or it could be someone who has leukemia and receiving chemotherapy. That is the major group that shouldn't get vaccine. There is a very small percentage of the population who has had very severe allergic response to components of the vaccine, but that's very rare.
So how are these people protected if they can't get the vaccine?
We count on the other people in the community who have been vaccinated to protect them. You can think of it as these people are in a bubble, and around them are the people who've been immunized. And if in a community you can keep that level of immunity up against measles, then measles cannot spread. That when measles is in a community, it finds the people who haven't been immunized and can cause an infection. But if there are enough people in the community, it will not circulate.
So is that the idea of herd immunity?
That is exactly the idea of herd immunity.
Right. So if a person gets immunized, it actually benefits themselves, or if the parents get their kids vaccinated, they get the benefit, but it also benefits people in the community who may not have been vaccinated, who couldn't get vaccinated, or the few that get vaccinated but don't respond to the vaccine, because the vaccine is not 100% effective, right?
That is exactly right. It's a fantastic vaccine. I mean, when you think about it, to be 98 to 99% effective is amazing. But when you're looking at large groups of people, you will have some who haven't responded. And you're exactly right. You are counting on the people who have been immunized to protect those who don't respond, as well as those individuals. And that also includes young children, because infants are not given the vaccine. Children respond best to the vaccine when they're 12 months or older. So we're also protecting the young infants, as well as the immunocompromised and others who can't have the vaccine.
Right. Now, like I said in my introduction, the United States declared that measles is no longer endemic in the United States, but we're still having cases. Why is that?
We're still having cases because measles is circulating in many parts of the world. There are many cases that occur in Africa and in Asia each year, and unfortunately also in Europe. And I think we really need to look at Europe and learn from what's going on in Europe, because in the late 1990s, there was a paper that was released that described an association between measles vaccine and autism. And this originated with a researcher in the United Kingdom. And following that, measles vaccine levels dropped in children. And what has resulted in the intervening years is that measles has really taken up shop in a number of countries in Europe. They have not been able to eliminate it. There are pockets where the level of vaccination is 70% in some communities. And they have seen a recurrence of measles with a vengeance. And that includes deaths in children, intensive care unit admissions. This is really a severe disease. And yes, we have eliminated it, which means that we don't have ongoing circulation in the United States. But in 2014, we had 644 cases of measles. And in order to consider it eliminated, there is not ongoing transmission for a 12-month period. We are really at a dangerous point in that we may have ongoing circulation. And if measles does reestablish in the United States, that will be a major problem.
Right. So is it the lack of vaccination among some folks that leads to this risk of the resurgence of the disease?
Absolutely, because immunization really prevents the ongoing circulation of measles in a community. What is going on now in the US is that people travel to other countries, and if they do, they can be exposed to measles, they can bring it back, and then it can circulate if the level of immunization in the community is not high.
Mm-hmm. All right, we're going to take a little break, but when I come back, I want to talk about what's called vaccine hesitancy, where people are resistant to getting vaccinated, because that's the major issue, and talk a little bit about what needs to be done about that. But we'll be back right after this message.
Don't let E. coli mosh with your food. An estimated 3,000 Americans die from a foodborne illness each year. You can't see these microbes, but they might be there. So always separate raw meat from vegetables. Keep your family safe at foodsafety.gov.
Welcome back. We're talking about measles in the United States and throughout the world with Dr. Ruth Lynfield, the Minnesota State epidemiologist. Ruth had talked a little bit about vaccine hesitancy. We're hearing a lot about that, and people who are resistant to getting vaccinated or postponing vaccinations with their kids or developing different schedules. Tell us a little bit about why that is such a big problem.
Well, first I want to say that really the social norm is vaccine confidence, and people need to remember that. And we are so lucky to be living in a time where we have such a safe and effective vaccine. Vaccine hesitancy is when people are hesitant or have concerns about a vaccine. And within that group, there are some people who have concerns because of things they may have heard about from their friends, from their neighbors, from the internet. And then there are people who are fiercely opposed to vaccine. The larger group is the group of people who have concerns. And unfortunately, there's a lot of material available about vaccines, but not all of it is correct.
And now, you'd mentioned the thing about the article about autism, and there's no link.
No, there has been a lot of work that has been done. The Institute of Medicine has looked carefully at huge amounts of data and have not found any association between vaccine, specifically measles vaccine, and autism. And the individual who had published his work in the Lancet retracted the article. This is Andrew Wakefield, and he had his medical license revoked in the United Kingdom. And I think really there is very strong scientific evidence that there is not a link. And when people have reviewed his work, it has been found to be fraudulent.
Then why does this persist, do you think?
It persists because people are very upset about autism. Children develop some of the signs and symptoms of autism around the time that they're getting their vaccines. And it is just a horrible, horrible condition for a family. And I wish that we could say, your child developed autism because of this reason. But we don't have all the information we need right now to explain why some children develop autism. There is a lot of work going on in that area. There may be some genetic components. There are probably some additional components. But we don't know all the reasons. And I think when a syndrome presents, people think back, well, why did my child get autism? And they link it back to perhaps what may have been going on at the time. And they read about it in the paper, they hear about it from celebrities. And so it is one of these urban legends that has gotten perpetuated.
What about the other issue? There are a lot more vaccines now than there were 30 years ago. People are concerned that much more antigen, too much being given to kids. What do you say to that?
Well, I say the reality is that when a baby is born, a baby is exposed to a huge number of antigens every minute from then on. And vaccines have been carefully researched, carefully studied. These are antigens or proteins, sugars, materials that we give to children. We know the dose, we understand what the response is, and the whole point of giving it to the children is so that they are protected against an infectious disease, a virus or a bacterium that's going to do real damage. And so this is a safe way of allowing them to develop a response so that when they encounter that germ, they can now deal with it.
I understand actually because of the improvements in vaccines, the antigenic load is lower now than it was 15, 20 years ago with different kinds of vaccines.
There have been changes in the formulation of vaccines, absolutely. And people not only study carefully the vaccines before they get licensed, but there actually is ongoing surveillance that happens to look for adverse effects. And so this is continuously being monitored, and if something arises, it is something which is looked at and addressed.
Right. In the last minute, what advice do you give to parents?
I think, again, we are so lucky to have such an effective vaccine against such a serious disease. We've been talking about measles today, but there also are many other vaccines, and the diseases that are out there can be very severe. They can be very severe in otherwise healthy children, and that is why we have these vaccines. And we have them on a schedule. Some parents use alternate schedules because those are the times of highest risk for those children. So if you wait until your child is 5 to give them a vaccine that they should have gotten when they were a couple of months old, you're not protecting them at the time of greatest risk for them.
Well, and I'm old enough to have seen many of these diseases before the vaccine came about, and they're horrible. And it's, like you said, we're really blessed to have those things that are very effective at preventing some major killers in our society. Ruth, thank you. This has been very helpful, and appreciate you coming back. And we'll have you come back and talk about other infectious diseases in the future.
Thank you.
Good. And I'll be back with a closing comment right after this message.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Instead of doing my usual closing comment today, I'm going to end with a video produced by Christopher Hahn, a medical resident at Oakland County Hospital and a rap artist who has some Minnesota connections. Dr. Hahn is trying to find different ways of getting across the message that parents should get their children vaccinated. Let's see if this video called Les Miserables can do that. So let's take a look.
Now, back here to the new warning from the CDC about measles on the march in America.
Behind the outbreak, many unvaccinated travelers, bringing measles back, and an increasing number of parents who won't vaccinate their children.
Tonight, we're tracking a surge of cases, outbreaks now in 13 states. The number of cases growing at a pace not seen in nearly 20 years.
So the measles are back, like a new fad on Madison Ave, wearing rashes like fashion statements. In the matter at hand, it's how a fraction of the nation's been attracted to this anti-vaccination campaign run by hacks, masquerading as experts, making false claims and accusations. And I would sit back and just laugh at every last statement, but I can't, cause the fact is it's dangerous. Acting like we're taking pediatric patients, strapping them down, stabbing with radioactive agents by some mad physician who just finished an amputation in his bloody white jacket and a mask adjacent. Cause you graduated college and you got an education, think you understand data. Let me get your facts straight and take you back to pre-vaccine civilization. What happened when all we had was natural immunization? What that means is, well, you were actually infected with one of these diseases. You survived, you're protected. So keep in mind these could be quite serious. So let's use measles to describe the experience. A virus so contagious it can be acquired by sharing the same space. It stays in the air and it takes 2 hours to wait before it's safe. In most cases, a bad fever and rash, and most people are fine, but on average 1 in 500 will die, or they'll get brain damage or happen to go deaf if they manage to stay alive. And with millions infected, that's a lot of lost lives. And we made great strides with modern sanitation systems, hand washing, water contamination, but even with that, diseases ravaged the nation till we were saved by genius achievement, vaccination. So listen up, this here is a science lesson about bacterial and viral infections, how injecting some some material has got us protected from the worst serial killers nature ever invented. So this is a psychology class. We repeat that same something. Something goes wrong, we have to blame. Something we protect our offspring, but problem is we're afraid of the wrong thing. So each infectious agent's like its own special agent with its own 007 identification. And once we unlock the code, it's lock and load. Immune system zones in and that virus got to go. Antibodies attack, tracking down the pathogen. And remember the pattern in case they ever come back again. But we need time to rev up the system. So in the meantime, you develop some symptoms. The cough, fever, nausea, diarrhea. So fatigue can only speak in onomatopoeia. Then we got the idea to use an injection to expose you to the code, but without the infection, to mimic the situation, stimulating the system and get it habituated without you getting sick. But you see, in some patients can't give it in some cases. Weak immune systems, infants of young ages. But of the whole population, there will be a small fraction that gets inoculated but won't have a reaction. They depend on the rest for medical reasons to keep them safe from vaccine preventable diseases. The virus is a forest fire, these people are the trees, and the rest form a fireproof shield with vaccines. Cause you vaccinate enough people in your community, protect the most vulnerable. It's called herd immunity. Listen up, this here is a science lesson about bacterial and viral infections. How injecting some material has got us protected from the worst serial killers nature ever invented. So this is a psychology class. We repeat that same something. Something goes wrong, we have to blame. Something we protect our offspring, but problem is we're afraid of the wrong thing. My own infinite home, infinite love, grown every minute, it's like I don't wanna blink. And yeah, I'm scared of autism, but the cause isn't known, and all wisdom is shown, there's no link. I got my own infinite home, infinite love, grown every minute, it's like I don't wanna blink. And yeah, I'm scared of autism, but the cause isn't known, and all wisdom is shown, there's no link. Cause the paper that said this makes kids autistic is based on false data and fraudulent statistics. The author that did this paid the price when it cost him his medical license. Still caused a huge distraction from the true concern, the real cause of autism. So much yet to learn. Still some don't vaccinate, ignoring evidence. An epidemic infection's been soaring ever since. Not a lack of intelligence, they wanna be safe, just don't know who to believe. Guess we've all lost faith. We don't trust Congress or our teachers. Our preachers might not trust your doctors or trust me either, but believe this, we care about public health. We get buried in debt and go through years of hard work because we care about others, not just ourselves. And when it comes to the kids, wanna give them a shot, just give them a shot. Vaccines are the answer, believe it or not. They can even stop cancer. The reason we've all gotten to take for granted that smallpox been eradicated from the planet, like we all forgot that now we're growing old, knowing no one who's been paralyzed by polio. Then you go and question something like this. You're out protesting and pumping your fists, looking for a connection that doesn't exist. You just spread an infection, putting others at risk. And I get it, cause we're made to save our offspring, but problem is you're afraid of the wrong thing.